10 breast facts, things you should know about your breasts. You don't need scientific proof to tell you that men like women's breasts, but there's still plenty of research to back up that claim. Despite their popularity, all we know is that both men and women really love them and talk about them all the time. We're all born with boobs, yes, both men and women, and they're wonderful things. But how much do you actually know about them? Breasts play an important role in reproductive anatomy, breastfeeding, for those who choose to do it. And our sexual anatomy too, since they're often sexually sensitive. We're all reminded to look after our boobs, keeping tabs on their shape and any changes, giving ourselves regular breast exams, and seeking medical help if we ever have concerns. There's so much we often don't know about this body part that might surprise you. So in this video, we shall be seeing 10 facts about your breast you need to know. Remember to subscribe if you are yet to do so. To give a thumbs up. Leave a comment. Share with friends and loved ones so they also benefit as you're about to. Now, 10 facts about the breast you should know. 1. They have their own monthly cycle. Fluctuating hormones cause your breast tissue to change week by week. In the days after your period, breast tissue feels smoothest, thanks to even hormone levels. Mid-cycle, your nipples may become more sexually sensitive due to increased estrogen levels. Finally, the week before and during your period, extra progesterone may leave your set swollen, bumpy, and tender. Popping an OTC painkiller and cutting back on caffeine can help quell the ache. 2. Sleep affects your shape. Hitting the sack face down won't completely deflate your twins, but it can make them misshapen over time. Pressing your breasts against a mattress all night can, after at least a few years, change their shape. The best snooze style is on your side, with a pillow under them for support as you sleep. 3. There are 7 types of boobs in the world. It's theorized that there are 7 types of breasts among women, according to experts. Despite common belief, it's not just breast size that varies significantly but shapes as well, and it's the shape that determines the 7 different types of breasts. They include round, east-west, side set, teardrop, slender, asymmetric, bell shape. 4. There are 8 types of nipples in the world. There are 8 different types of nipples. All of them are normal, and it's certainly possible to have a combination of 2 or more types. The different types are as follows: protruding, flat, puffy, inverted, unilateral inverted, bumpy, hairy, supernumerary. 5. Each pair has its own point. Not only do nipples come in varying sizes, but they also point in different directions. Whether your nipples go up, down, left, or right depends on their structure and where they really sit on the breasts. Some really rest a little higher, which can angle the nipples upward. Others rest lower or are closer to the edges of the breasts. Some women even sport a pair that aim in opposing directions. 6. Your breasts can be of different sizes. Something that a lot of people are uncomfortable about is asymmetry. But the truth is that about 50% of women have uneven breasts, and usually, for reasons we don't really know, it's the left side that's a little bigger. This size difference echoes a similar pattern found in men. About half of guys have asymmetrical testicles, and the left testicle tends to be the larger one. Our bodies, in general, are never perfectly symmetrical, so it's usually nothing to worry about. 7. Most breast lumps are not cancerous. One of the most common misconceptions is that every breast lump is cancer. Women will feel some sort of lump or thickening in their breast and immediately think the worst. Breast lumps are extremely common and are not likely to be cancer. All sorts of things can grow in the breasts, like cysts or benign tumors. Breast tissue also changes as hormone levels fluctuate, and they can feel lumpier than usual before you get your period every month. Anyone who does feel something different should mention it to their doctor, just to be safe. Do not freak out right away before you have more information. 8. Sagging is inevitable. Unless you have corrective surgery, getting older means your breasts will sag over time. Other culprits include gravity, smoking, and sleeping. In fact, if you're a stomach sleeper, you might consider changing positions. Some reports show that sleeping on your stomach can actually change the shape of your breasts. 9. They're thin-skinned. Because they were stretched as you developed, breasts have thinner skin than the rest of your body, leaving them susceptible to dryness. Keep your pair supple by moisturizing them with a firming cream that stimulates collagen and elastin growth and has UV protection and retinol to prevent wrinkling. Don't ignore your nipples either, they're also prone to dryness. Give them a daily dose of a super emollient moisturizer, like Vaseline or Aquaphor. 10. Pregnancy can make nipples darker. Surprise! We all know pregnancy comes hand in hand with a lot of bodily changes, and darker nipples are a really common one. Why does this happen? It all comes down to pregnancy hormones that stimulate a temporary increase in the amount of melanin, the naturally occurring substance that gives pigment to your hair, eyes, and skin the body produces.
As more melanin is made, areas that already have more pigment, i.e., areolas, scars, and freckles, can get darker too.
That would be all for now. Thank you for watching and staying to the very end. See you next time. Until then, remain blessed.